Hi, I'm Cynthia Schiller. Please like and subscribe. I had a viewer wanting to know a little bit more about the brain imaging of the narcissist. I've done some on the brain damage. This goes a little bit more in depth. I'm going to share some screens with you on just the abuse, how it affects the brain, and why the narcissist is unable to really relate to us. So let me get you into the screen sharing and I always forget how to do this. There we go. So this is what the normal brain looks like. You can see a lot of activity going on, and this is a narcissist brain. This is a part that is responsible for empathy, a lot of our emotions and feelings. So as you can see here, there's nothing there. And if you stay tuned, I have a lot more in-depth things. I'll go through the screen sharing and then I'll go to the notes. But this is a narcissist brain. And due to neglect, they've had portions of their brain shrink. And psychopaths are unable to have empathy. The narcissist has very little empathy. There are varying degrees on how much empathy. But this is kind of interesting. This was Dr. James Fallon. He was a neuroscientist studying the brains of psychopathic killers. So he even decided to scan his own brain just as a control. And he realized that he himself was a psychopath because there are traits. Now, this is a psychopath which has a lot of characteristics of a narcissist, is just one step further. And when he told his friends and family this, they universally responded, that explains a lot. So the brain can tell us a lot. And here you can see the psychopath's brain compared to the narcissist is very similar. Like I said, there's varying degrees depending on the type of damage that your narcissist went through, but they just have something so different than the normal brain. You can see so much is missing. They have reduced gray matter. Here again, you can see that the normal brain, and look at all that's missing. And the amygdala is the part right here that is responsible for the emotions and regulation and understanding, the empathy, and it's just a lot different. There's a lot that is deadened. So the amygdala, also again in the psychopath's brain compared to I'm sorry, this is the normal brain on the psychopaths. So here, it's so much damage that has been done. So the parts of our brain and what they do, the parietal lobe, this is knowing right from left. It deals with sensation, reading, body orientation, how we move our bodies when we touch things, where we need to reach out for. The occipital lobe, this deals with our vision, color, and perception. Each part of our brain has a specific function. The cerebellum down here deals with our balance, coordination, fine muscle control. In the frontal lobe, this is problem solving and emotional traits, reasoning, speaking, voluntary motor activity. And right here is the temporal lobe, deals with behavior, memory, hearing, understanding, language. And then we have our brain stem that deals with our body, such as breathing. And this is there's been a couple spelling errors. This is something I found, so deal with it. This is breathing, body temperature, digestion, alertness, and even our swallowing. So the frontal part, and also it's really close to the temporal lobe. That deals with the emotions and reasoning. Our healthy brain. Now we got to be careful too, because look, this is somebody with PTSD. A lot of us have developed CPTSD, which is complex post-traumatic stress disorder. And it cuts down on the brain's function, its ability to function correctly. We're starting to turn narcissistic because we're starting to damage our brain. We do get brain damage from dealing with narcissists. So just remember that if you're wanting to stay with them. But as you can see, we go through the depression during those 5 stages of grief. This is the depressed brain. And as you can see, the recovered brain, there's a lot more activity going on. And I'll get into the note portion now. Sorry, there's all these things I got to click on. Okay, good. So the cognitive dissonance in a relationship with a narcissistic personality disordered partner can be substantial. So we're going through all these different things. And we got to figure out like what is going on with our narcissist. So in recent years, we can actually see in the brain imaging tests, such as MRIs and CT scans, we can actually see people who suffer from NPD, which is narcissistic personality disorder. They have structural abnormalities in regions of the brain that are linked to empathy. So researchers have continued doing some research and found that people with NPD can take another person's perspective in a purely intellectual way, but they find it difficult to feel what the person is feeling. They can't relate to it. They can relate to what they're feeling, but they can logically understand, like, okay, I guess you're sad that your dad died, like that makes sense, but they don't feel. So when they don't feel what you're going through, they might not help out more with the kids. They might be like, okay, she's sad, but it's starting to get a little irritating. They can't relate to it. And a lot of them think that this is the defining feature, but they also have other deficits. So if you're wondering what is the root of all these brain abnormalities, it varies. So people with NPD, it's theorized that they had some trauma during their early childhood that damaged their brain, also halted normal development. So they're stuck emotionally in a childlike state. And if you guys have ever been around kids, they like to throw fits, they don't take accountability, they'll lie. And trauma and abuse has been shown to actually alter the cellular structure, also the neural pathways in the brain. So there's like when your impulses are going through, it's a disconnect. They're not communicating correctly, your neurons. And so this development in these critical parts of the brain didn't proceed into a healthy way as they should have. So for the narcissist, psychopath, something similar happens before birth, and they are simply born that way for a narcissistic psychopath. So psychopaths are no empathy, and a narcissist, NPD, has 5 and 9 traits. So when children suffer at the hands of their abusers, which will often be narcissists. So if you know what your partner, what their parents are like, you can kind of see where the abuse came from. And the important crucial parts of the brain regions that are affected are the anterior insula, prefrontal cortex, hippocampus, the amygdala, and cerebral cortex. So these changes in these critical parts of our brain, as these kids become adults, they abuse their own partners and children as well. So what are these parts of the brain? The anterior insula is the left and anterior insula region of the brain. So this is thought to be involved with our cognitive functioning, also the regulation of emotion. Narcissists often can't regulate their emotions. They have rages, they throw temper tantrums, and it's been tied to the creation of compassion and empathy. Narcissists aren't always compassionate. They lack empathy. They can't relate to what we're saying. And there's an affective subjectivity, which is the awareness of and reflection of our emotional responses, also the development of a capacity for self-reflection and emotional attunement. So narcissists aren't in tune with their emotions. They don't know why they're acting the way they are. They just do it. And a lot of it is subconscious. So a person with NPD, it's almost like they can never truly feel. They feel anger, but they don't really feel love. And I've been going through YouTube channels about some of these self-aware narcissists, also reflecting back on my narcissist, and they don't get it. They do not get it. So the YouTuber was self-aware, and he doesn't get it. One of my exes, I'm not sure. I know he's gone to counseling, and I don't know what for. We didn't really get into it. But he doesn't get it. So it seems like he's more self-aware, but they still don't understand it, and they'll straight up tell you, I don't love the way other people do, or they don't understand why we're acting the same way. And a lot of their actions are sometimes subconscious, sometimes purposeful. It can flip flop. It's very unstable in a narcissistic relationship. So these people are known to have less gray matter in their brain. Also, the anterior insula is connected with subregions of the prefrontal cortex, and we'll talk about that. So the different areas of the brain have different roles, but there's problems with the connections. So this anterior insula is a critical neural substrate, and it deals with emotional awareness. And narcissists are just incapable of possessing that. They don't have the portion of their brain, or it's extremely shrunk. And so let's talk about this prefrontal cortex. And this is one that plays an important role both in narcissism and psychopathy, and they have overlapping features. So remember, when you're dealing with a narcissist, it's really close to dealing with a psychopath. So think about that. Um, so there's portions that control and regulate a number of social and affective decision-making functions. And these appear to be disrupted in cluster Bs, which are where they have 5 and 9 traits. There's also borderline, sociopath, psychopaths. And the cluster B let me reword that. It appears to be disrupted in the cluster B narcissists, sociopaths, and psychopaths. So the hippocampus, this is important for learning, also for the development of memories. So people with NPD have a dissociative disorder, and it prevents them from assessing real memories. So sometimes a narcissist will get really frustrated. They think they're telling the truth because they don't remember it the correct way, or it just didn't commit to memory. So they make up stories to fill in the blanks. So the past is viewed through magical thinking, delusions, grandiosity, and it forces the narcissist to rewrite history. They create their own narrative about the past, and it's filtered through selective amnesia. Selective amnesia. Also, the inability to accept any blame for what they do. So sometimes, well, just like that YouTuber I was watching, you could see the frustration. He even said, he's like, I think I might need to take a break from YouTube, because he was getting really upset. He's like, I'm so sick of hurting people. And he's so sick of being misunderstood. And sometimes they get frustrated. You could see it. They don't, I mean, you think about people who are becoming with Alzheimer's or dementia. I saw with my grandfather, 98.5 years old, the frustration he felt on not being able to access his memories. He was starting to lose his brain function. And you see the frustration. So narcissists get frustrated too. My grandfather, it was due to age, but the narcissists, they're trying to talk and they feel that they have to fill in the voids. So continuous stress due to abuse can damage the brain cells in the hippocampus, making it gradually shrink in size. And this is how a narcissist was originally created, but it's also how the victim is affected. So be careful. I will say for myself, after years of abuse and rumination and not understanding, all that stress, it gives you a harder time focusing, harder time communicating. It starts messing with our brain too. And the sooner we surround ourselves with healthy people, the better we'll be. So the amygdala, this is what you guys have probably heard about. This is a key portion for emotional processing. This is in the amygdala where emotions such as fear, guilt, envy, and shame are born. So narcissists have a lot of shame that they like to hide, that they squash, but they also have a flat emotional effect, and most of their emotions are unexpressed or inappropriate. So is their rage appropriate the time that they're lashing out when we're just trying to communicate? So people who have personality disorders are missing a conscience. So that's why they have an easier time cheating. They just feel like if they're not caught, what's the big deal? What they don't know won't hurt them. They'll feel entitled to things, or they might steal things or try to justify the things that they do that they shouldn't. And due to this flat effect, sometimes you can even see it in their eyes. So if you guys could comment below, have you seen the flat effect? The visual or verbal absence of appropriate responses can be caused by conditions that include things such as autism, schizophrenia, NPD, narcissistic personality disorder, traumatic brain injury, depression. Sometimes you can get a traumatic brain injury. And I talked about Phineas Gage, who had a steel rod put through his head, changed his whole personality. I knew somebody who had a stroke and they become more emotional. They're unable to regulate their feelings as much. So our brains really deal a lot with our emotions, how we handle them, why we have triggers, why we get upset. And people with NPD often do not feel fear or guilt. So a lot of times they don't feel that fear. Have you ever noticed your narcissist? Comment below. Were they prone to bar fights? Were they prone to physical abuse, abusing? You know, did they think that they were immortal almost, where they could handle anything? It's just not something that's in them. They don't really fear things. So that's why they might be risk takers. You know, they might feel that, you know, they're not scared to try cocaine because they're not going to have a heart attack. It's going to be okay. So they're more risk takers. And they felt these emotions when they were very young. But when they silence who they truly are, these emotions are not simply repressed, but they're eradicated, they're wiped out. So it's not really a repressed where they can draw from those feelings. They're gone, they're eradicated. So in the cerebral cortex, it forms the external nerve cell layer of the brain. So people with NPD exhibit structural abnormalities within that portion of the brain. And they have to have that if they are going to process and create compassion. So they just aren't able to. So in the Journal of Psychiatric Research, there were some researchers showed that people who have NPD inside their cerebral cortex, it's unusually thin in the region responsible for empathy. So it's unusually thin. So it shrunk. And they also had gone on to say that the degree of loss of empathy in NPD patients matches up with the degree of thinness present in an abnormal cerebral cortex area. Also, the authors did another study, and it was published in the Journal of PLOS, linked to the presence of narcissism to increased activity in another part of the cerebral cortex that helps control impulsive behavior. So there's like a balance that's trying to go on, but this activity increase diminishes impulse control. So their brain is overacting, causing them not to have impulse control. So this increases the likelihood that they're going to make poor decisions. Also, there's something called diffusion tensor imaging, which measures the amount of connected activity between different brain areas. So people higher on the narcissism scores had lower connectivity between certain brain areas. And this also included the prefrontal cortex, the ventral striatum. And within these areas, it is associated with the ability to think positively about oneself. So the narcissist might prompt the narcissist to repeatedly have compulsive built-in need to seek out affirmation and also adoration from others. So they don't have the natural ability to feel confident within themselves, and they want to feel wanted. They want to feel important. It's kind of, we want to be noticed in life. People need people, and so they want to fit in, and since their desire is so strong, they make up things, and this kind of goes along with the theories that conclude that these people are kind of divorced from their true selves. So they don't even know who they are. So they create this false image, they present the false image, and yeah, why not make the best image out there if you're going to create it? They show us this fantastic person, which isn't them. And we fall in love with this fantastic person who is just a character. The narcissist writes their own narrative. It's almost like we played a role in a movie, because the narcissist keeps rewriting the script just to get what they want. And there's also been other studies that are continuing to be ongoing, and they think that narcissism might be the core of psychopathy. They definitely have overlapping features and exist in the same cluster B category on the Diagnostic Classification Manual, which is the DSM. Psychopathic individuals are unable, have an inability to have true relationships, limited affect processing. They don't have anticipatory anxiety. They don't have remorse. So if they're going to murder somebody, they're not going to be all anxious about it. They're just going to do it. They have impulsive behavior styles, and they don't have a forethought to even think about or evaluate how the actions and also is it appropriate, inappropriate? They kind of don't care, and they don't know how to process that. So these can manifest, the characteristics can manifest into psychological disorders, and they are often influenced by things such as chemical imbalances, childhood experiences. There is some heredity with some mental illness, even illness. High fevers can cause brain damage. Prenatal exposures, whether fetal alcohol syndrome or drug abuse from the parents. And so the victims of narcissistic abuse, are starting to come forward, and a lot of them are demonizing the narcissist because they've been so traumatized and so blindsided, and it's like an infection where you're fine with a few infectious little molecules, but as it flourishes, it can be damaging. And that's the same with the narcissist. We just get a little bit of the infectious material, and we don't realize what it's doing to us till it's almost too late. So definitely, I always like to, not always, I try to mention 988 in the United States is a free suicide hotline. So if you guys are struggling with that, because narcissistic abuse, I've had several of my viewers like want to end their lives, and that's not the way to handle it. It's hard. It's something we have to go through. We have to go through the 5 stages of grief, but it's worth becoming you again. So the person with NPD is mentally ill. They're brain damaged and just incapable of being healthy. So a lot of people like to vilify them. There are, it's hard because you can't force somebody to feel something. But the narcissist has been told how to act, how to be respectful. You don't have to feel things. You don't have to agree with it to understand what's right. But the narcissist, the way they communicate, they're going into that brain. And since they don't feel it, their reactions are abusive. So they live in this alternate reality, like many schizoid personality types also share these same type of common traits. Magically, fantastically, beyond reach. They're compulsive, and a lot of their actions are unconscious. So they have neurological, psychological, spiritual, mental, energetic, and psychological disorders. And, some of us feel like we can't live without this person. We can't live without him. Some of us believe it's our soulmate, but it's a sickness. And that sickness is going to infect us. And it's just going to cause us to become sicker. And if you guys would like to, well, I'm trying to think. I'm going to do a different video. I don't want to keep you guys too long. I'll do it right now and record it on politicians, the narcissist politicians. Should MRI brain scans be required for all candidates? So I'll do that. If you guys would like to see that one, type in politicians in my search engine. And thank you for the request. And I'll see you in the next video. Topic requests are always welcome. And have a good day.